Well, good afternoon, everyone. And I'm Jim Rooney, President and CEO of the Greater Boston Chamber of Commerce. I want to welcome you all on this snowy New England day. I hope everyone is joining us feeling safe and healthy and has their shovel and snow melt and snow blower all ready to go for another February winter event here in Massachusetts. Um, at the Chamber, I think as many of you know, we're committed to being the leading voice of the region's business community on issues that affect business and commerce here in Massachusetts. And certainly one of the issues top of mind for the business community is the vaccination distribution to the public. Certainly a priority as we think about economic recovery, as we think about competitiveness, as we think about our health and the health of our employees. I've received many questions and inquiries over the past month or so since the vaccine process started. As employers are thinking about their own reopening plans and getting back to work and what to tell their employees about this situation. So we decided to reach out to Secretary Marylou Sudders, who was kind enough to agree to join us for a special policy event here at the Chamber, where we'll hear an update on COVID-19 status generally, but vaccination plans and what's going to happen going forward from Secretary Marylou Sudders. She'll be joined today by Secretary Mike Kennealy from the Office of Housing and Economic Development. So a nice connection between the public health community and the business community. They'll review, among other things, the role that employers can play in supporting their workforce and how the distribution plan prioritizes equity. A few webinar housekeeping notes. I want to flag that this webinar is private and closed to the press and the media. We're holding this special policy event as a chamber members only event for the benefit of our members. We will have a Q&A period during this webinar, so please submit your questions throughout the session using the Q&A feature. Or if you're more comfortable, email questions to chamberprograms@bostonchamber.com. And with that, let's get started. I'm pleased to introduce our special guest today. Marylou Sudders is the Secretary of Health and Human Services for the Commonwealth. And on the heels of our Pinnacle Award program last Friday, is a Pinnacle Award winner of the Chamber just a couple of years ago. Secretary Sudders leads 12 agencies and Mass Health, which has 22,000 public employees delivering essential services to the residents of Massachusetts. Secretary Sudders co-chairs the Governor's Interagency Council on Housing and Homelessness and Interagency Council on Aging. But more, I guess, in the context of today's world, Secretary Sudders leads the state's COVID-19 Response Command Center and is a regular feature on our television stations these days. Previous to joining Governor Baker's cabinet, Secretary Sudders served as the Massachusetts Commissioner of Mental Health and as an associate professor at Boston College School of Social Work. Welcome and thank you so much for being here, Secretary Sudders. Next, we have Mike Kennealy, the Secretary of Housing and Economic Development. Secretary Kennealy is responsible for advancing economic opportunity, job creation, business growth, and new housing in the Commonwealth. Secretary Kennealy previously worked at the private equity firm TA Associates and Spectrum Equity, managing billions in assets and investments. Secretary Kennealy serves as chairman of the board of visitors for the Nelson A. Rockefeller Center for Public Policy and Social Sciences at Dartmouth College. And before I turn it over to Secretary Sudders and Secretary Kennealy, I do want to thank Secretary Kennealy in particular for your first weekly and now bi-weekly updates to the business community and many of my colleagues leading chambers and other business organizations across the state. Valuable information that we receive on a weekly basis on things that continue to happen, whether it's PPP updates, phases of reopening, and at times as necessary, bringing other members of the Baker-Polito administration, Secretary Acosta, and recently Secretary Sudders, to those calls to maintain the lines of communication with the business community. So Secretary Kennealy, thank you for that over the past year. And with that, I'll turn it over to Secretary Sudders and Secretary Kennealy for today's program.
Hey, Jim, thank you very much. Happy New Year. I should probably let my good friend, Secretary Kennealy, give opening remarks, and then I'll sort of go into a little bit of a deep dive into all things COVID and COVID vaccine. How about that, Secretary Kennealy?
That sounds great, Secretary. I'll be brief. And Jim, thank you so much for getting us all together today. And thank you for your close collaboration throughout the pandemic. I'm glad the weekly, now bi-weekly calls have been useful. They've been incredibly useful for us to hear what's happening on the ground in our business communities around the state. So thank you for that. I always like to take this opportunity with business groups to thank you for all you've done in partnership with us during the pandemic. Businesses, in many cases, remained open safely. They reopened safely. We got such great input as we crafted our reopening strategy back in the April and May timeframe. We've had countless examples that are frankly inspiring to talk about the dozens of businesses that have come forward to be part of our manufacturing emergency response team, where manufacturers have repurposed their production lines to start making personal protective equipment. Certainly our banking sector has really risen to the occasion by working really hard to get small business loans out the door. There were so many great examples of businesses working in great collaboration with us and truly meeting the moment. I can tell you from an economic development standpoint, we'll continue to do what we can to get this economy back on track. Hopefully folks saw back in the October timeframe, we announced a comprehensive economic recovery strategy for the state. Of course, we continually look at the public health data and always are evaluating where we are with respect to reopening restrictions. We were delighted to have our economic development bill passed and signed by the governor last month. And as we speak, we're rolling out the nation's largest small business relief program. So a lot happening on the economic development side of the shop here. And again, thank you all for your partnership, your collaboration over this very difficult last 11 months or so. And with that, we'll turn it back to Secretary Sudders.
Great, thank you. And it's so first of all, thank you for having me. It's always good to be with the chamber, and I'm really grateful that Jim has never asked back for the Pinnacle Award. That I was so honored to receive, and with a company of extraordinary women executives and leaders in the Commonwealth. So I applaud the chamber for honoring women in accomplishment at the Pinnacle Awards. So let me give you a little sense of where we are in all things COVID. Today is actually a little bit of a sobering day on the 1st of February. I don't know if anybody wants to go back in time a year ago, but it was on February 1st of 2019 that we confirmed our first COVID positive case in Massachusetts. And that was the young man who had traveled to visit his family in Wuhan, China, who is a student at UMass Boston. And that, so here we are, almost 500,000 cases later in Massachusetts. But we have all stayed through this together. And, you know, there is light at the end of the tunnel. And the light at the end of that tunnel is vaccines. My friends like to say it's really not another train coming at you. It is, these are vaccines. And that is the hope. And that is, a lot of this is a credit to the extraordinary science and biotech community in Massachusetts, who really have stepped up on the science. But before I get there, let me just remind us how we've gotten here a little bit. So we have experienced two surges. The surge in the spring, which was like a train wreck that came at us. It came at us fast and hard in the Northeast. And, you know, our healthcare system weathered it strong, strained but strong. And that's a credit to our healthcare system in Massachusetts. So we never were overrun in our emergency departments. Our hospitals in Massachusetts completely acted like a system. And we set up, as you know, a bunch of support systems around them, whether it was field hospitals, isolation recovery hotels for individuals under 400% of the federal poverty level and the like. Ramped up testing. I remember the press conferences in the spring and some of our media friends wanting to know, well, why was it we thought we needed a capacity to test 100,000 people a day, and the investment at the Broad and a couple of other places to really build up lab capacity? We all know why it was important to have really strong lab capacity. And Massachusetts has the second highest, we're the second per capita tester in the continental United States. And now we see how how testing, the PCR testing has now morphed into being able to create pooled testing much more cost effective in order for us to try to get our schools reopened, our kids back in schools. Summer, we thought maybe we were coming out of, coming out at the back end, and with Secretary Kennealy and others' leaderships, including people now like our CDC director, Rochelle Walensky, we started to reopen. We started to reopen in May. And then come fall, as we sort of assumed would happen, we experienced a second surge. And the second surge, while not as impactful as the spring, very different. Who was affected in the springtime, very different than who was affected in the fall. And we really saw the impact of asymptomatic transmission, which, as we now know, people are carriers without knowing that they are carriers. Hit a little bit of around Thanksgiving, despite all of our urging individuals to please, try to modify your Thanksgiving plans this year so that we can all celebrate the way, we like to celebrate holidays with our loved ones and large families and the like. We saw the relaxing, if you would, or the weariness people have to, a bump in the surge. What I can tell you now, and you see the data, we put out the data daily, is things have stabilized. Our hospitals never closed their non-COVID services for the most part. And we have about 15% capacity in our healthcare systems across the state. So in December, we finally started to see that light. So everyone knows, I'm not going to go through all the detail. 2 EUAs were authorized for the Moderna and Pfizer vaccine. And on the 14th of December, which feels like a lifetime ago for me, but on the 14th of December, the first resident in Massachusetts was vaccinated. And that actually was an individual in the VA system. And then starting at the end of December, we started to vaccinate people. But before I get too deep into vaccines, in October, because I think it's important, because we all look at the data together, and I'm sure you'll have questions as to why Massachusetts is not leading the pack in vaccinations. In October, we brought together a group of folks outside of government, as we often do, to advise us. And Vaccine Advisory Group, chaired by Paul Bittinger, Dr. Bittinger of Mass General Hospital, and included a number of individuals, folks from community, folks representing communities of color, faith leaders, mayors, folks from public health, folks from healthcare, to advise us on how should we think about rolling out vaccines, knowing that they would be constrained, that we would have a supply issue in the beginning until such time we had a lot of vaccines. So the advisory group recommended, and we accepted in the administration, the recommendations had 3 priorities. And I'm going to explain just a little bit about what the differences are in Massachusetts as compared to any other state in the union. So 3 priorities, no surprise: preserve our healthcare capacity. Because if we don't keep our healthcare capacity strong, we will not work our way through the pandemic, of course. We've never had to implement crisis standards of care, if people know what those means. We've never really had to ration healthcare when you got to the hospital. So protection of the healthcare system. Second, preserve life. Can't reverse death. And the third was to address equity, to address the communities and the individuals of color who have been disproportionately impacted by the pandemic. Folks who may be distrustful of healthcare and institutions, if you would, and government because of institutional racism and the like. But equity had to be part of our vaccine program. So when you look at the priorities in Massachusetts, there are a few things that make our phase one in particular very different than almost every other state in the union. In fact, I can't find another state who did the same thing. One, as you all know, healthcare is a predominant industry in Massachusetts. It's big. It's a vital part of our economy. So we defined healthcare very broadly. Healthcare was not just our frontline physicians and nurses. It also included dietary, sanitation, environmental services workers, lab techs, and the like, because you can't run a hospital without these other folks, one. And two, we wanted to ensure that in employees who are disproportionately represented in communities of color, that they were included and not excluded from vaccines and healthcare. That was one. Secondly, we moved all of congregate care into phase one. That includes homeless shelters. It includes correctional facilities, yes. And I've gotten some of those emails. How is it you prioritized individuals who committed crimes over my mother or my grandmother? So we've gotten those. So we prioritized congregate care, of which we have thousands in Massachusetts. Group homes for people with intellectual disabilities. Group homes for individuals recovering from substance use. Group homes for people with mental illness. Shelters, our domestic violence and sexual assault shelters, our veteran shelters, our individual and family shelters, both staff and residents, residential schools for kids with special needs. So all of those went into phase one. And then a third group that we felt was also very important were home health aides, home health workers, personal care attendants, of which we have 40,000 personal care attendants in Massachusetts. Again, these are overrepresented in communities of color, both in terms of employees and staff and the people that they work with. So that took our phase one group, made it large and expansive and broader. It also meant in reaching out to those communities, to those group homes, to those congregate care facilities, that it would take more time to reach them. And these are very personal decisions, as all of you know. These are voluntary decisions. Vaccine for COVID-19 is voluntary. So where are we today? So today, these are hot off the press numbers. We have been shipped 1.06 million vaccines total, first and second doses. And we have administered just under 628,000 vaccines for a administration from a distribution to administration rate of 59.2%. We have stood up mass vaccination sites that are extraordinarily efficient, really well run. And for anyone who is ambulatory, it is a really good and safe and effective option if you, once it's your turn, and I'm very clear, once it's your turn. So we've been opening mass vac sites, and then today actually Fenway Park opened, which is a partnership with Fenway and CIC, which I'm sure many of you know, CIC Health. Gillette opened. Gillette was the first. And that's actually where we sort of worked with Gillette and others, and Brigham and Women's Hospital, to figure out the playbook of how to do a mass vac site. So we will have 7 mass vac sites across the Commonwealth. And it will be, those will have the capacity to flex up. So as more vaccines come into the state, we will be able to increase their ability to vaccinate people in Massachusetts. But that can't be our only solution. And I want to talk to the business community a little bit about that. Our hospitals are obviously been vaccinating. We have reached out to local boards of health, particularly in areas for like first responders. 119 local boards of health stepped up to vaccinate first responders. About another 104 of those are thinking about what their next steps will be in vaccinating perhaps more vulnerable residents of their communities, people who are homebound, low and affordable housing programs and the like. Community health centers, right? Trusted community health centers in Massachusetts. We're working with 58 of them right now to help them be able to vaccinate the panels of their members or reaching out to community. So we can't have a one size fit all in Massachusetts. There are some states that have done that, where they just send vaccines to their county health departments and say, we'll tell you what you get and you do it. But that's, we're a more distributed, dispersed community here. And we are trying to maximize our excellence in the field. And I'm going to do this quickly because I know there's questions, and it's important for us to hear your questions, and we can worry together because I'm a worrier. When we made the decision around 75-year-olds being eligible, of which there's about 430,000 individuals over the age of 75 in Massachusetts, we had worked our way through about 40% of phase 1. And one of the reasons to open up to 75-year-olds, of course, is, aside from the fact that they're vulnerable, is also every other state around us had been opening up their vaccine programs. Were we perfectly ready for that? No, because our systems, in fact, are sort of technology based. And we're stepping up a call center. Sorry, somehow I got muted. That will be live by the end of the week. And we have a soft launch going on right now, which, as a couple of hours ago, not only had it not crashed, but was helping individuals take their information so we can help them find appointments. But employers. So here's what employers have options. So one is, at the end of this week, we will have our very first large public awareness campaign. We have materials on our websites, which we're happy for all of you to pull down and use. So that is just one. One is encourage your employees to get the facts, understand the science through your human resources departments, through your virtual lunchrooms, however you engage with your employees. Get them the information. There is skepticism by many individuals, particularly folks who just don't trust government, who don't trust vaccines and the like. And I would just ask you to engage with your employees. I'll just give you one set of facts. Across skilled nursing facilities in Massachusetts, of which we have 379, 88% of the residents have accepted vaccines. 54% of the staff. We obviously have so much more work to do to convince some of our employees to accept vaccines. So just truly engage people with the facts. The Chamber, an extraordinary source for information. We've done these teletown halls. We did one a couple weeks ago with 11,000 personal care attendants and home health aides, with an infectious disease doctor, an allergist, and someone from their community who'd been vaccinated. To just open town hall, what are your questions? And sort of do like the ask the doctor kind of questions. I would encourage, I'm sure the Chamber has deep resources, your members, to be able to do that for other employers. Employers who are large, who have the capacity to, for those of you who do flu vaccines now this is not the flu vaccine clinic, this is different. But for those of you who have done vaccine clinics, you could become a site for vaccine for your employees if you were interested. And I think Lon Povich and Mary Joyce, who work with me, are available, who I think are listening to this, are available to the chamber to help explore what that might look like for employers to do. Or employers, if you're large enough, to really partner with a clinical provider to provide for employees with vaccine, or just encourage, all of you have health insurance for your employees, partner with where they get their health insurance so that when it's their time, their insurer reaches out to them to help them connect for their vaccines. Really, so it's about awareness, engagement. If you're interested, we can work with you about the potential of you becoming a site for your employees to be vaccinated, or to help you find a clinical partner, or literally just then work for you with your insurance company if you're self-insured to ensure that your employees have access to vaccines when they become available. We do expect in the next few weeks that J&J or others, there will be more vaccines available in the Commonwealth, and we are building up the staffed capacity. We have come to appreciate that some of our vaccine channels are more efficient than others, and we have been leaning in with them about getting their inventory out and not holding back second doses for fear that the federal government would not send second doses. So we have been working with some of our more concerned vaccine channels to ensure that they administer, like from the point now where you're distributed a vaccine, you have 10 days to administer it. And we are redistributing or not forwarding new vaccines until you work through your inventory. So I think you will continue to see progress in Massachusetts. It is the hope. Until then, and I will sort of end on this note and then turn it back over to Jim and your questions, it's important for us to continue to practice those good public health measures. And the business community has been very strong partners in this, which is to wear face coverings, engage virtually, unfortunately. We all miss the company of one another, wash your hands, and, really, isolate yourself if you're not feeling well, get tested, and, vaccines will become much more readily available in the coming weeks. So with that, Jim, I'm going to turn it back to you. Thank you.
Hey, well, thank you, Secretary, for that update. A lot of information. I always prepare my questions, but I'm looking in the Q&A feature, and I don't think I have to use many of my own. You're certainly generating a lot. But I do want to, and as much as this is a business audience, business people, they're very focused on numbers and metrics and goals and benchmarks and data and the like. You mentioned sort of the hot off the press numbers about number of vaccines received and, that in people's arms. Can you project forward? I mean, in terms of the schedule of receiving vaccines and how many would you expect by the end of February and March and April? Do you have that kind of benchmarking?
So I wish I had that crystal ball. As you know, the federal government has purchased all of the supply of Pfizer and Moderna, which were the first two out of the box. And states really had no lens into what was being manufactured and what would be available to states. In fact, we tried to get a first right of refusal with the wonderful company Moderna. It's a Massachusetts company, and we were like first in line in the event that we would be able to have a contract for Massachusetts. And President Biden has made it very clear that vaccines are the responsibility of the federal government, and they will be supplying them for states. So that's one. We've been on a week-to-week allocation, which is difficult to run a vaccine program. Like, what are you planning for? It is actually Rochelle Walensky, who is the new CDC director, and as you know, comes from Massachusetts. We were finally told a week or so ago that you could plan no less than what you've received for the next 3 weeks. So we'll receive about 101,000 first doses a week. and have been assured that second doses will follow. And one of the hesitations, Jim, in Massachusetts was by our healthcare systems, the fear that if they scheduled a first vaccine, the first dose, that they wanted to make sure they had the second dose in their hands in order to schedule. And so we've been a little bit of this, people holding on to second doses, even though the appointment wouldn't be for 3 or 4 weeks out. And we've made corrections to that over the past 10 days or so, being very clear with our, we don't blame anybody. I mean, I understand the ethical dilemma. You don't want to schedule and then have to cancel.
Yeah.
But we have both a math and a messaging challenge that we're trying to get on the other side of now.
Okay. Couple of questions that I think you kind of invited in your remarks.
That's good.
So why did the prisoners get preference in phase 1? And can you talk about, the decision to put the sort of elderly in phase 2? And maybe I'll combine a question there about vaccines opening up to the 65 plus group. When will that happen?
Yeah. So thank you for those, I think, and thank you everybody. So I want to go back to the 3 priorities, and the priority of equity, and how to address equity and populations disproportionately impacted. So when you think of correctional facilities, first of all, 24/7 facilities can become super spreaders, whether it's a correctional facility, a skilled nursing home, a homeless shelter, right? People close together, you can't get out, right? So you are, and we have seen that in our correctional facilities, as well as in some shelters and certainly in skilled nursing facilities. So the advisory group felt that congregate care was a place that you needed to prioritize for vaccinations, from skilled nursing facilities to assisted living to congregate care programs. It is also disproportionately either serves individuals of color or staffed by individuals of color. And that's the equity lens that the advisory board felt very strongly about, that you needed to put in place. And when you think of a correctional facility, even if there is not sympathy for an inmate as it is for a 75-year-old, it is the staff of those correctional facilities, since there's such a high rate of susceptibility of COVID within correctional facilities, the staff coming in and out, if you don't vaccinate them, then they're going home and exposing their families. So that is one of the reasons that the advisory board felt strongly about congregate care facilities being in phase 1. Not just, and we can debate whether that was the right thing or wrong thing, but it does get to individuals who've been disproportionately impacted by COVID. Of course, everyone's been disproportionately impacted by COVID, but these are more disproportionately impacted. 75-year-olds, we're in phase 2, and as you know, we moved them up to the top of phase 2. We're trying to not be, I think coming out of the gates, perhaps the messaging from the Department of Public Health was, it's COVID facing healthcare workers only, and you also don't want to waste the doses. So we're trying to be a little more flexible, and I think that's been acknowledged over the past few weeks, that if you have an open vial, please keep using it. And it does mean it starts to get a little, around the edges, a little frayed, if you would. But you don't want to waste the doses. And 75-year-olds, when you look at the mortality rate from COVID of individuals over the age of 75, it is like 2.5 times more than individuals over the age of 65. So we felt that was the right thing to do. In terms of individuals with 2 complex medical conditions, so I'm not using the word comorbidities. We're trying to talk in Webster's English, and people over the 65 is, I hate to give a date because I know it's going to happen. Someone will say, I heard the secretary say this date. We're looking to serve, the timeline continues, and the end of February-ish And obviously, if J&J is authorized by the EUA, that sort of really opens opportunity.
Okay. And when, just quickly, just based on the rate going now, when would you expect to get to the 65-year-old?
So probably towards the end of February.
Okay, great.
Is that your group?
No, I'm not there. I'm in the last group still. Couple of questions about the elderly, and some things in the news around the website, and the elderly's ability to sort of use online tools and not their skill sets, and people helping them, and we've heard issues about the website. Can you talk about that? And I know there's some talk about a hotline and that sort of thing. Could you update people on those issues?
Yeah, and thank you for that. So there's certainly some older adults that are technologically sophisticated, and there are a lot who are not. So we will have a call center stepped up by individuals over the age of 75 today. And I understood at Fenway Park at 10:15 this morning, about 200 individuals had already gone through to get vaccinated. I had a 78-year-old secret shopper do the experience for me today, who I just searched her how she could go get, online. She's sophisticated technologically. And I was grateful that somebody I knew actually was able to make an appointment, go at 10 o'clock this morning and get vaccinated. And I had like a text by text moment of the experience. So it's quite positive at Fenway Park. That's my narrative of one person at a new mass vax site. But it's clear we need a call center. It is navigating whether you go through your primary care physician or you go to a retail pharmacy or a mass vax site, that if you don't have a family member who can help you navigate that, or a neighbor or someone, that we need to have a higher touch for people. And in hindsight, that should have been up when we announced last week 75-year-olds. And what we have now is that we have a soft touch launch, which has actually been working well today through we have 25 groups called Aging Services Access Points across Massachusetts. And they've been taking information calls from older adults. You have to know what year you were born. And if it's before 1946, they will sort of refer you to our 211 system. So that is up, and we've done a refresh of the website, so it looks cleaner when you go through it. Sort of takes you logically through, like, am I eligible? If I'm eligible, what do I do? If you put in a zip code, it shows you the places around and the like. So it's and we have Lon Povich is sort of leading a group to look at more advanced technological solutions for people as well.
Okay. Couple of questions interesting to me anyway. I'll read this so I don't get it wrong. I understand the CDC is issuing vaccination cards for the general public in order to track the completion of doses, et cetera. Does Massachusetts plan on providing credentials of some sort for e.g. visual and tracking purposes, perhaps an ID badge, smart chip technology, et cetera? Is that something we're thinking of, or that's going on in other places?
So when you go to, so I'm sort of at the back of the line also. When you go to get vaccinated, you get a card, okay, which has been issued by the CDC. And I'll send you the deck so you can sort of see what it looks like, so that if you were to be vaccinated elsewhere. I have a call tomorrow. I don't know, today is Monday. I have a call tomorrow with the White House and also with the new Health and Human Services about the next things that the CDC want to make available to states. The Region 1 calls are this week. So I'll have more. You have to invite me back, or I'll send you a written response to the question. How's that?
Okay, great, thank you. Question, I hope it doesn't come across the wrong way, about the guiding principles, and keeping in mind that this is the business community. So no mention of the economy, getting people back to work, the kinds of concerns of employers, and how does bringing back the economy factor into the rollout consideration under those principles that you articulated, and, getting businesses back open, getting, people back to spending money?
It's, I would point out that the healthcare industry is also an employer in Massachusetts, and we needed to keep them open, keep their doors open. So if any of us had healthcare issues, would come in the gates. I do think one of the reasons, so my goal is to have 80% of vaccines that are distributed to the state administered within the 10-day period. And one of the reasons I've sort of set aggressive goals going forward is to be able to sort of continue to reopen the economy and move down the phases to the business community, right, into more sectors than healthcare, health and human services industries, correctional industries, and the like, and teachers, quite honestly, right, to be able to open up schools. It's if you just do the math. You can yell at me about, 1 million doses being provided, and we have, and you have to sort of divide that in half, because it's really like 500,000, because it's 2 doses for every person to be fully vaccinated. So if you get 100,000 first doses a week, we're still in a pretty constrained environment, and we will be prepared if another vaccine, so I can flex up the mass vac sites to about 305,000 right now. We're about doing 25,000 a day, to about 305,000 with like 2 weeks notice if I needed to really flex. So we're building the staffed capacity if we have vaccine coming to us. That's one. And then really working in the other places where employees get their health care, and hoping that those, not little PCPs, but larger ones, right? Because you need efficiency and scale with this kind of a vaccine program. But it's a fair point.
A couple of questions in the queue, kind of following up on specific types of workers. And you mentioned teachers, that's one in the queue, about prioritization of teachers, also utility workers, construction workers who are in these, they're working side by side on construction sites. What about prioritization of particular types of workers like that?
Yeah. So transit, teachers, grocery store workers, all transit is in phase 2, and sort of this large group of right after the 65-year-olds. And what I'm really hoping is that once we work our way through people with comorbid conditions and 65-year-olds and have had say 1 or 2 more vaccines available, particularly if you have a single dose vaccine, we're going to be much more efficient, and that should really open up. We have paused right now on, so first of all, everybody wants to be in phase 1. Let's just be clear here, because all of us, right, most of us want to be vaccinated. And so we literally sort of paused on any more detail in phase 2 until we see more than 100,000 doses coming into the state as we get closer to 65-year-olds. So I know there's funeral directors, veterinarians, there's a whole group of people who are a little frustrated by not being clarified any further. But right now, our goal is to really increase the rate from distribution to administration.
Okay, number of questions in the category of offering to help, or suggesting they have offered to help but have not heard back. For example, we've offered the state mass vaccination site. If we want to do on-site vaccinations, how do we do that? There's one in here about, I don't even know if they are, but the dental community wanting to sort of be part of the team giving vaccinations. I don't know, kind of a hodgepodge of can we help?
So I have the 7 sites for mass vaccination sites. So I'm grateful for people who've offered physical plants. We are, unless I open more mass vaccination sites, unless the state opens more vaccination sites, I'm in good place for buildings. Employers who are interested in either doing vaccine clinics or and I'll send you the link, but or wanting to partner, Lon Povich, and I'll send you the email. Lon is back, sort of doing work with me, and Mary Joyce in the command center, and they've both been like really active with a bunch of the business community. So I'm sorry if somebody has not been responded to, because we're usually pretty responsive about that. So dentists can vaccinate now. The Board of Registration of Dentistry about 10 days ago actually included COVID vaccines as part of their repertoire. And we've expanded vaccinators to include medical students, nursing students, physician assistants, and did a 6-year extension to people who've retired. Physicians who've retired can actually be vaccinators for the like. So first of all, Jim, because you and I email. If somebody emails me, I'm pretty fast, a little slower than I used to be, and I send it off to the right people. And these are folks who are pretty responsive. So.
Okay. So
I could throw Secretary Kennealy under the bus and say, send everything to Secretary Kennealy and he'll send it to, but truly, if there's like a list to you, if you send them to me, I will make sure people.
And if you get me those contact people, I'll get them out. Yep. So what is your plan, or what is the plan, and what are your expectations when for retail pharmacies as vaccination sites?
Yeah. So Walgreens, CVS, and about 30 independent pharmacies have signed up to be vaccinators. So this week, you will see a number of retail pharmacies open up in Massachusetts. We had a few last week, but they are starting to proliferate this week, and those you'll see up on the website. So certainly CVS, Walgreens, about 30 independent pharmacies who can do vaccinations, as well as other retail places like once I start naming, I won't remember them all. Stop and Shop, Wegmans. A friend of mine was teasing me, oh great, I can go buy dinner and go get my vaccine at the same time, Price Shop, me, I take all that we do seriously. I tend to be slightly irreverent just given all that we're doing. Price Chopper, Stop and Shop, and the like. But they're smaller, but they're definitely convenient for folks.
Okay. A question on the equity goal, and the question suggests that right now, let me just make sure I read it right, about 3% of people of color have been vaccinated. I don't know if you have updated data on that, and if you do, that'd be great. But with that as a principle, sort of, how do you mentioned some of the tactics, but how do you prioritize equity?
Okay. So equity, so we do put out a dashboard weekly on Thursdays. That's generally when we put out a weekly dashboard, because I think it's important for all of us to see the truth of age, the truth of gender, the truth of ethnicity. And I do have it. Hold on. I can't read my own, I can't see my own colors here. It is, so I'm just going to do first doses just because, so individuals who are Asian is about let me just do so Hispanic, Black, Asian, and people who put down multi-races is about 25%.
Okay.
But Black is about 3.5%.
Okay. And I mean, I guess a follow-up, you mentioned it earlier. I mean, confidence and trust, is that a tough issue for these populations?
I think one, structural racism. I think health inequities. I think trust. I think information. Where do you get, Michael Curry, the wonderful Michael Curry, who's president of the League of Community Health Centers, was at a press conference with us, I don't know, last week, really talking about speaking out to the community, like listen to the science, right? Get the facts And so pushing out very different kinds of messaging and different kinds of community engagement. That's in part why we did the teletown hall in English, Spanish, and Haitian Creole a couple of weeks ago for personal care attendants to just, what are the facts? So this is much more like boots on the ground, public awareness, community to community, and it's going to take longer. There's also some of the health hospitals said that first rounds of vaccines, a number of staff sort of took I'm going to wait and see before I step up. So I'm hoping that as more people get vaccinated, as more facts come out, hopefully some of that reluctance will decrease. But there's a lot of, a lot of.
In terms of either reluctance or the rollout to date, I mean, what's anything surprising you around that issue?
I think what has been surprising has been in the early, so health providers request what they think their supply needs are. And then we would, in the early days, distribute the vaccine. I think there was, people were overly optimistic about what they thought the uptick was going to be. And then really worked very hard at trying to get, to really reach out to their staff who are Black and brown, and realized it was going to take longer and a lot more messaging and a lot more seeing what was happening in their community. So it was that, and I think of conservatism of wanting to hold on to both doses, even though it was going to be 3 or 4 weeks out for your second dose. I think we did not anticipate that people would hold on to the vaccines and not keep working them through. So we sort of pivoted a couple of weeks ago, and you see, I watch this every day, and we're now up to, like I said, 59.2%, and about a week ago it was about 50%. So I think that was a surprise.
Yeah.
I'm not surprised by. I'm saddened by the reluctance given the science, but it's understandable, and that really challenges then us to really find different channels of communication and to just keep working it, and we'll keep working it and working it.
Yeah, there's a question that I think I could answer, but I'll ask you anyway. It's really, I think, speaks to sort of the, who is able to give a vaccine. The specific question is whether employers or landlords, for example, can request vaccines directly to vaccinate their tenants and employees.
So there's a guidance, and I'll make sure that, and again, we'll send you the PowerPoint, which has all the links in it. Yeah. There's a guidance we put out on December 22nd. It's up on the website on the 6-7 steps to become a vaccination site. One is obviously size, the ability to vaccinate about 200 people. And you have to be registered with the Department of Public Health. Yes, it's a short form. This is not a long bureaucratic process. And that's one of the reasons Mary Joyce and Lon Povich are working with us for those employers who want to engage. It is different than a flu vaccine because you do need to observe somebody for 15 minutes to 30 minutes. And you need to have someone there in the event someone has a reaction to the administration of the dose.
Yeah, but I can't apply to give vaccines to my employees myself.
I hope not. I hope you can.
I didn't think so. So
you have to be someone who is licensed or certified to be able to do.
Thank you.
Yeah. No, social workers can't either. It's not part of my. It's not part of my group.
I'm not really asking for it. So we've got just a couple of minutes, so maybe I'll try to hit some of these last questions. One, you mentioned the different manufacturers, and any inside information on their production capacity and what the Biden administration is doing that could help speed this up? Because there was an earlier question that someone did the math on the current rate will be here until forever.
Oh, come on, it's not forever. It's 6.9 million people in the state. And so so 6.9 million. And the goal is somewhere between 75 and 85% of your adult population over the age of 18. So it starts to narrow down a bit.
Yeah.
But I'm expecting at least, again, all we've had is the press releases around J&J, and at least a couple of others with a really quick ramp up. And the thing about, I'm assuming, if again, this is press release, not data, that J&J is going to request to be authorized as one dose, which is a game changer.
Yeah.
Right?
Yeah.
One dose as opposed to 2 doses between 3 or 4 weeks.
Yeah.
So
Okay.
slightly less effective, obviously more convenient.
Okay. And I'll work in one last question to you and we'll close. It's I don't see it in front of me, but it had to do with sort of, I don't know, differences of people are seeing in different cities and towns across the state. Oh yeah, some towns are not included in vaccine sites, and neighboring towns seems like a lot of inconsistency, blah, blah, blah. The geographic issues, I guess, across the state, how would you sort of?
So when you look at residents by county with doses, it's actually pretty evenly distributed across the Commonwealth of Massachusetts. Not where vaccines were distributed to providers, but when you look at a person's residence, it's actually fairly distributed across Massachusetts. So that's one. And two, we have the most decentralized public health system in the United States. We're the only one without a regional structure. It is very much local boards of health. And we're working with local boards of health. We want to work with them to sort of figure out what their sweet spot is in this space, which, some want clinics, right? Some want to do regional clinics. Some want to do only first responders. Others have greater capacity. So you've seen one local board of health. You've seen one local board of health. I'm not being disrespectful. I mean, they're very efficient. But if you do the math and you have 100,000 first doses a week and 350 local boards of health, there is only so much supply at this time. So regional structures are much better. If you look, I want to give a shout out if anybody's here from Berkshire County. Berkshire County has done a complete collaborative system. All the local boards of health with a county structure, with the medical center, the ambulance companies are rolling out as one collaborative, and they're really, really efficient. And that's a good model for people to come together.
Well, Secretary Marylou Sudders, thank you for taking the time. Thank you for taking the tough questions, frankly, and answering them. Look forward to continuing to work with you. We'll share the information as we get it. Consider us a resource at your disposal as you continue to lead this effort for the Commonwealth. Secretary Mike Kennealy, any closing thoughts? We didn't have any questions for you, my friend.
I got off easy today, Jim. No,
got off easy, yeah.
It's great to be with everybody, and thank you all for your ongoing partnership.
Yeah, thanks everybody. Stay well.
Thank you all. A couple of commercial messages. On Tuesday, February 16th at 2, a forum, CEO's Perspective, Technology in the Business Community, featuring a great lineup. Corey Thomas, CEO of Rapid7, Sarah Fay, Managing Director of Glasswing Ventures, and several others. They'll provide insights about the future trends for technology as we move forward in the reopening of the economy, and a feature event of the Chamber each and every year. Join us on Thursday, February 18th at 10 a.m. For our Government Affairs Forum featuring Massachusetts Governor Charlie Baker. Sign up for that event. I'm sure it will be an interesting event, and we'll report in that Secretary Sudders and Secretary Kennealy did a fabulous job today.
We're set up.
You can sign up for these and other programs by visiting bostonchamber.com. Once again, everyone out there, stay safe during this snowstorm and going forward. We wish you all healthy and happy 2021.
Be well. Take care. Thanks a lot for having us.